Good day, everyone. I'm David Bloom, an economist and demographer at the Harvard T.H. Chan School of Public Health. I'm also faculty director of Harvard's NIH-funded program on the global demography of aging. I'm a principal investigator of LASI, the longitudinal aging study in India, and I'm a founding co-editor of Elsevier's Journal of the Economics of Aging. Along with my economist colleague, Maddalena Farana, and my geriatrician colleague, Ben Seligman, I've prepared for this webinar a short background paper on population aging and economic polarization in Asia. The purpose of the paper and of this video teaser is to inform and stimulate participation in the webinar, to serve as a fire starter of sorts. I have three sets of preliminary comments that I'd like to convey. First, I'd like to apologize for my inability to share my remarks live. However, as you hear this recording, it's 3 a.m. at my home in Cambridge, Massachusetts, and I'm hopefully enjoying a good night's sleep. Second, I'd like to thank Help Age International's Eduardo Klein, Caitlin Littleton, and Peter Morrison. My co-authors and I appreciate their giving us this opportunity to share some ideas with you, as well as their thoughtful comments on the structure and content of our background paper. And third, I would offer my compliments to the organizers on their choice of topic for this webinar. Thus far, population aging appears to be the dominant demographic trend of the 21st century, and inequality appears to be the dominant social and economic issue. As prominent as these forces are globally, they're even more pronounced in Asia. And whether they're viewed through the lenses of ethics, human rights, political stability, or social and economic well-being, there's simply no hiding from the fact that population aging and inequality are core elements of human progress, both individually and in tandem. My objective for the next few minutes is to summarize my paper with Farana and Seligman. Briefly, it makes 4 points about the interplay of population aging and economic inequality among low and middle-income countries in Asia. Point A, population aging is a driver of measured economic inequality. This point follows from the fact that disparities between the old and young tend to contribute more to overall inequality as the population share of older individuals rises. It also follows from the fact that inequality tends to be higher among older age groups than among their younger counterparts, which is a reflection of early life inequalities in human capital accumulation, employment, and earnings that are magnified as people age. I would also note that inequality undermines the goal of healthy aging. Point B, measured income inequality is an imperfect indicator of true economic inequality. It's imperfect because it neglects the relatively large value that older people create for themselves and for their families and communities through the varied and significant productive non-market activities they undertake. I'm speaking here of the time they spend minding, educating, and socializing their grandchildren, the time they spend caring for others, and the time they spend working around their homes and doing volunteer work. It's not yet clear whether taking account of these non-monetized sources of productive activity would increase or decrease measured inequality. But the world needs to end its inattention to so many forms of economic contribution among the elderly, and to stop overlooking the consequences of those contributions for our understanding of trends and patterns in inequality under conditions of population aging. Point C, older people's vulnerability to COVID-19 infection and to severe COVID disease, which is especially prominent among those who are less well off, is sharpening the association between population aging and economic inequality. This process is reinforced by a whole suite of now familiar social and economic policies designed to prevent and control COVID. Throughout Asia, these policies impinge disproportionately on older persons. It impinges on their ability and opportunities for employment, and it impinges on their food security and psychological well-being, especially in informal labor market settings and in the absence of strong social protection systems. Indeed, a recent World Bank report highlights the effect of COVID-19 on rates of extreme poverty, especially among vulnerable populations in South Asia, which indisputably includes large numbers of older adults. My last point, point D, is meant to convey a bit of good news. The good news is that we have plenty of options. We have at our fingertips a range of public and private health and non-health interventions that can disrupt the link between population aging and economic inequality. The health interventions include disease prevention, universal health coverage, and the implementation of innovative care models. The non-health interventions involve a range of social protection programs like pensions, insurance against unemployment and disability, and programs for reskilling and relocation. First-order interrupters of the contribution aging makes to poverty and inequality also include immigration policy, housing and urban design, and non-ageist policies and practices. Some of these interventions target the improvement of well-being among those who are currently older. Others target the improvement of well-being among the future old. But taken together, even a subset of these interventions can plausibly do much to appropriately acknowledge the past contributions of older people and also to enable their future contributions and to enhance the experience of aging. In so doing, they will also reduce the inequality-related burdens that will naturally accompany population aging in anything that even remotely resembles a business as usual future. Thank you for your attention.